You know that feeling when you try to take a big, deep, satisfying breath and you just can't? Like there's this tightness in your chest and nothing seems to fix it. Well, what if I told you the answer isn't in your lungs at all, but it's actually hiding in your spine? We're about to dive into a really surprising connection between a single nerve at the base of your neck and your very ability to breathe.
It is so frustrating, isn't it? That feeling of having to think about breathing, that constant tightness. Maybe you've even been to the doctor, had a bunch of tests run, and they all came back perfectly normal. You're left with this mystery, and you still can't get a good breath.
So the source of this whole thing, it might not even be your lungs. It could be right here, at the base of your neck, where it meets your upper back. And that suggests the problem might be more mechanical than purely respiratory. All right, so let's get into it. We're going to explore a factor that often gets completely overlooked when it comes to breathing. It's a nerve that has this huge direct influence on how your ribcage works, but, its role in respiratory health just isn't something we talk about very often.
Okay, so let's meet the main character in our story today, the T1 spinal nerve. It comes out of the spine right here, between the first and second vertebrae in your upper back. And its job? Oh, it's absolutely critical. It sends the signals to your intercostal muscles. Those are the muscles that literally expand your ribcage every single time you breathe in.
So how can this one little nerve cause such a huge problem? Well, it usually boils down to a small structural issue that, believe it or not, has these massive ripple effects on how your body actually functions. The key term here is vertebral subluxation. Now, I know it sounds super technical, but basically it just refers to a vertebra that's thought to be a little out of place or not moving right. The theory is, when this happens at that T1 level, it can irritate the nerve and mess up the signals getting to your breathing muscles. Now this is really, really interesting. Look at the order of events here. The functional problems, things like shallow breathing or just getting exhausted from sitting up straight, they show up first. The pain, that burning or tingling sensation, that actually develops much later. And that's exactly why the root cause can fly under the radar for so long. You feel the weird effects, but you don't feel any pain right at the source. Okay, so what causes this misalignment in the first place? Well, more often than not, it's our own daily habits. It's the slow, steady strain we put on our bodies, day in and day out without even thinking about it.
Just take a second and think about your own life. What's your job like? Your posture when you're driving or watching TV? Could the things you do every single day be slowly contributing to this exact problem? What in the world do an office worker, a violinist, and a swimmer all have in common? I mean, look at this list. It all comes down to repetitive posture. Whether it's your head jutting forward to look at a screen, or rounding your shoulders to hold an instrument, or that constant overhead motion from a swimming stroke, all of these things can put chronic, focused stress right on that T1 vertebra. So, here's the good news. According to this model, this problem isn't necessarily a life sentence. The idea is that a T1 subluxation can actually be found and addressed, which could open up a real path to relief.
The correction process, from a chiropractic point of view, is pretty systematic. It's not random. It'll usually start with a deep dive into your health history, then a look at your posture and how you move. That's followed by hands-on feeling of the area, and maybe an X-ray to really see the alignment. All of that info then leads to a very specific adjustment. And this really gets to the heart of it. The goal isn't just about moving a bone around. It's about taking the pressure off that nerve. The idea is to restore that clear communication line between your brain and your body so your respiratory system can just do its job properly.
And the intended result is what so many people are looking for, that simple ability to take a deep, full breath again. When that nerve interference is believed to be reduced, your ribcage can move more freely, which in turn could lead to better oxygen delivery and just an overall feeling of wellness.
But of course, an adjustment is really just one piece of the puzzle. To get long-term relief and stop the problem from coming back, you've got to look at the bigger picture and adopt some strategies for overall wellness.
And look, a lot of these are things anyone can do. Simply being mindful of your posture, doing some deep belly breathing every day to really engage your diaphragm, staying active with walks or yoga. All of these are powerful ways to support your spine and your respiratory health.
This particular approach also suggests that nutrition can play a supporting role. Things like supplements aimed at healthy inflammation, or omega-3s for lung support, or even herbs to help manage stress. But, and this is really important, you should always consult with a qualified healthcare professional before you start taking any new supplement. Seriously.
So if you take away one thing from all of this, let it be this. Healthy breathing is not just about your lungs. It's deeply tied into the entire mechanical system, your spine, your ribs that support them. And within this framework, healthy posture and spinal alignment are seen as being absolutely fundamental to breathing well. It really makes you think, doesn't it? If this one little nerve can have such a profound effect on something as basic as breathing, what other connections have we been overlooking? What else is your spine quietly influencing every single day?